Баллон Eclipse, да? Сейчас, да, спасибо. Так, смотри, вот здесь вот такая есть. Hello, dear colleagues, how are you? Flex Vision. Выходишь, select. И vascular. Mynzhylky. Бақ экран тарчыш. Hello, dear colleagues, happy new year. And I hope the crazy 2025 now continues to craziest 2026. It was an expectation that 26 will be more stable, less conflicts, but the year started with the action, action. And today we have a plan for 6, 7, maybe 8 patients. In the list now 6 patients. Several aneurysms. One meningioma. And intracranial stenosis, extracranial stenosis, and also the patient number 1, incidental finding, a patient with headaches, and on MRI angiography, this ICA aneurysm were found. Let's look like this. Maksat Gabitovich is a doctor of this patient, and he decided to do it with the balloon assistance. For me, the upper location of the small aneurysm usually little bit of challenge. The position of the microcatheter, the stability, and at the end, usually those aneurysms need stenting. It's better to end with stenting. That's why, for me, maybe it was better to start. It was better to start directly with flow diversion, but decision was done. And okay, we need to apologize, and with the respect, the left side, here's some changes. It's a loop. Okay. The venous segment, a little bit stenosis here, and this could be small irregularity of the ICA. Vertebro-basilar system look normal, and the right ICA territory. Little bit kinking. We should keep it in mind. And the guiding catheter is 8 French Hyperion, which is coronary guiding. And patient has good PCOM, has an ACOM, and let's see what we can do. Yeah. Okay. Now we have 8 French guiding, 8 French short sheaths, biplane angiography, Philips Azurion 7, Eclipse single lumen with the hybrid 12-14 inside. It's coming in the box, and Chikai black with the headway 17, which is regular, regular 17. Headway, this time we have 2 two types of headway 17. One is regular, and the second is advanced soft. Okay, let's see where we are. I think the guiding catheter not in the internal carotid. That's why. Yes, I just came from the vacation yesterday, and we stayed in Vietnam on Phu Quoc Island with family. It was quite warm, and the water was so comfortable. So many Kazakh people now choosing the Phu Quoc Island of the Vietnam, and it's just 7 hours of flight. And now my family in Astana. The school time is started yesterday, and yes, it's all the time hard when the family is in other city, and you should work in different city. But we will see. Okay, no problem. Yes. Yes, I don't like coiling this kind of aneurysms. It's better just to place the flow diverter stent, because we couldn't rotate the headway 17. It's not a echelon. With echelon it's possible, but with headway 17 it might be a little bit problem. Huh? Yes, it will not stay inside the aneurysm. Yes, I don't like this kind of aneurysm for coiling. Yes, nowadays Maksat is working in Taldykorgan City Hospital with the emergency patients. That's why he want to choose the coiling, and nowadays the technology with the flow diverter stent is better. Yes. Ай, бля. Көтті қинамай потолкқа қоя салу керек еді. Тартешка, да?
Круг жасасаң кіреді.
Yes, I understand if the aneurysm is 4 mm, 5 mm, then you can place the wire inside the aneurysm like a J, and after that the navigation is easier. But in a such 2.5 mm aneurysm with irregular shape, it's all the time challenge. Huh? Okay, I don't want to take a risk. I think it's better to switch this strategy. 4 mm. Бақыт, нейрослайдер бере салшы 27. Нейрослайдер 27. Жоғарғысы. Фент қоссаңыз, и мына жерден дерива 4,5-да 25. Okay, we'll place the derivo. 4.525, I think it's better. Neyroslайдер бере салшы. I asked Bachit is the operating nurse, to give me Neuroslider 27. It's a microcatheter from Phoenix company. A little bit stiffer than Headway 27, and through the Neuroslider 27 we'll place Derivo Hill 2. 4.525. Okay. We're using heat gun for microcatheter shaping. This year it's 13 years I started to use heat gun in Almaty. Not 13, 12 years. Huh? Okay. It's just 12 years and yes, when you use echelon microcatheter, it's possible to go with echelon and just rotate the microcatheter and position inside the aneurysm. And let's see, this was the headway. Yes, it will never work. Headway is not for rotation, it's just for placing. Huh? Different devices, different behavior. Just a second. Zoom. Okay. We gave the small angulation to microcatheter, but it's trying to stuck. Huh? Okay, now we are in M1 segment. We can take it out. As the brain is clear. Дерево. Келесі пациентқа келеміз. Yes, this patient premedicated with ticagrelor and aspirin. Verify now showed 99% of platelet inhibition. It's very effective and it's hyper responder, and maybe we'll switch for 60 milligram. We will see. Or we can just use the yes, anesthesiology team, Gulzia Seykaldievna, and the anesthesiology nurse. Gulzia Sitkaldina is a anesthesiologist, and we have a nurse. An operating nurse is Bahat. My assistant is Maksat Musabekov. He's a very experienced guy, and we are working together since 2012. He was my resident in National Neurosurgical Center, and now we are working together since in this hospital since 2016, for 10 years. Okay, let's see. I think it's shortened, and I don't want to cover the orifice of PICOM, as PICOM is not covered. The patient has a P1 segment. It's not a problem, but it's better to keep the minus. Yes, it's not covered. Yeah, it's just behind the PICOM. Okay, we may continue. Yes, this time on the shelf we have the Revo heel, we have Fred X, and we have P64 HPC. Okay. This Derivo is 4.25 by 4.5 by 25. Yes, it's adapted. Yes, the segment looks dysplastic. That's why we'll leave it as it is. It's very hard to go with the slider. Okay. We have balloon. If it's needed, we can do angioplasty, but I'm not sure we need it. Or we can do it. Okay. We can place balloon. Balloon is already on the table. Назад. Полный назад. There is a little bit of blood inside the system. Вперед. Назад. Yes, it's an Eclipse single lumen with the valve on the tip. When you take out the wire from the system, balloon is deflating. Yes, I feel myself much more comfortable with the stand placement. It's going down. as the catheter is went down. It's extracranial ICA. As the position of the guiding nerve non-stable. Now it's facing. Just a second.
Hangi cası istiyorsun?
That's for the stability. It's outside. Okay, let's inflate the proximal part first. The balloon is 4.5. Balloon is 6 millimeter, but the stent is 4.5, and the sizing is all the time might be problematic because the upper limit of the size is 4.5 millimeter. Yes, a little bit here. I think it's enough, huh? Enough is enough. Okay. Oh, it's okay. There is a stagnation inside the aneurysm, which is a good sign. And for cavernous part, very proximal side is not applying to the wall. There is a little bit distance, but the stent is shortened as much as possible, and usually it's not a problem. Yes, it's not a problem. The upper part is applying, and aneurysm is now stagnating. Yeah? Okay, it's okay. It will work. It's quite straight segment. Let's see the other projections. Even 4.5 millimeter FD cavernous part was approximately 4.4. Nice, that's good. It's 9 minutes from the deployment. Now we'll wait for another 6 minutes. I will ask Maksat to do expertity. Yes, and the next case, I think there is a MC aneurysm. There is a MC aneurysm. Okay, let's wait for the expertity and then we can finish. Dear colleagues, expertity is ready. Everything is clear. Patient a little bit moved, but it's not a problem. No complication, and see you in next 30 minutes. Next case is MC aneurysm, I think.